Hi, everyone. Again, welcome. We're so glad you could join us. This is the first workshop in our MCH Housing Champion Forum. So in this one, we're really going to be exploring some opportunities for you to look at some different roles and responsibilities and activities related to supporting housing in your MCH work. We'll also hear from some state examples, and then we'll have some time for y'all to kind of unpack and discuss what you've heard, what you've learned, what questions you have with each other. So we're going to keep the tone very light and informal. Feel free to ask questions throughout. But again, we're hoping this will be a very interactive, engagement and conversation with all of you today. So with that, we are going to, oops, I seem to have clicked the annotate button accidentally. We're going to go ahead and get started just sharing briefly what our agenda is for today. So we'll start off with a round of introductions, and we'll do a quick icebreaker. We're then going to spend a little bit of time sharing the impetus for this workshop and what led to this, and some current activities that AMCHP is exploring. We're then going to do a little bit of framing and background for our subsequent conversation around what this could look like in your respective states and jurisdictions. So we'll talk a little bit about implementation stages and how you can align your work with those stages. We'll then hear from two Title V housing examples, and then we'll spend a decent chunk of time in breakout rooms, unpacking what you heard, and then sharing again any questions, considerations, things that you're looking to explore, in the housing space, and then we'll have time to reflect and wrap up. So with that, I'm going to start off with some introductions. So in the chat, if you could let us know your name, your pronouns, where you're located, and what are you excited about for today's workshop. So for myself, I'm Linda Krisawati. My pronouns are she, her, and I am the Associate Director for Evidence and Implementation here at AMCHP, and I'm joined by two of my colleagues, Jess and Ben, who are also welcome to introduce themselves. But I think we're just looking forward to hearing from you and seeing how we can better support you all with this new national performance measure. So feel free to start typing in the chat. Again, your name, your organization, and what you're excited about for today's workshop. But Jess and Ben, welcome to introduce yourselves as well.
Thanks, Linda. Hi, everyone. I'm Jess Simon. I'm a Systems Change Senior Policy Manager at AMCHP, and I'm really excited to hear from our two states that are already doing work in this space, and also to hear from you all about what kind of work you might want to do and how we can support you in exploring your role at the intersection of MCH and housing. Over to you, Ben.
Thanks, Jess and Linda. Hi, everyone. Ben Kaufman from AMCHP here. I'm the Associate Director for Workforce Development and Capacity Building. I'm excited to hear how folks are conceiving or hope to conceive their role in ensuring housing as a human right through the lens of maternal and child health. Excited to be here with you all, and very, very grateful to my colleagues for doing the heavy lifting because I just got back from parental leave. Nice to see everybody.
And we are so thankful for Ben for joining us today. I know it's been kind of jumping back into the deep end with the work. And I really actually very excited just looking at the chat and seeing the reasons why folks are here on the call. And again, we're hoping this will be a really fruitful conversation with you all. We're not going to have all the answers today, but at least just starting this conversation and recognizing that we're all kind of in this space together, trying to figure out what does this look like for each of you in your respective roles and within your very unique context. So again, please continue to introduce yourselves in the chat and share what you're excited about. And with that, we're going to go ahead and jump in with our content. So we wanted to provide a little bit of framing and background as to why we decided to do this in the first place. So I think just recognizing that we have some new performance measures that have been developed over the past year. So in particular, we're really focused on the national performance measure focused on housing instability, which is technically two separate measures. We're looking at for percent of women with a recent live birth who experienced housing instability in the 12 months before a recent live birth. And then we also have housing instability for children. So the percent of children ages 0 through 11 who experienced housing stability in the past year. So I think just recognizing that this is new for a lot of folks in Title V. We had previously, looked at some of your block grant applications, and so there are, a few folks who are doing work in this space. But for the vast majority, this is probably something that's new and a little unfamiliar and maybe a little daunting. I think just having some conversations with some folks at the partnership meeting. So we wanted to think about ways that, AMCHP, in addition to, other folks at the national and federal levels, how we could work together to support you all in this endeavor, recognizing that it's new for a lot of us as well. And so this is where Ben actually helped kickstart a lot of this. So again, just really grateful for all of his relational skills and helping to get us connected with our HUD colleagues. And then we've also been able to collaborate with HRSA, the MCH Evidence Center, City Match, and some other folks in this space as well. And so our goal with us coming together was also trying to figure out how can we model at kind of this higher level what some of those partnerships could look like with folks who all have a role and resources to bring within the housing justice space. So we're trying to figure that out at our level and hopefully, be able to share how we're coming together to have these conversations, how you could also, emulate these within the state and jurisdictional level as well. So this is, again, very new for us as well. And so a lot of what we've been doing over the past several months is just trying to figure out like what our respective resources are, what our strengths are, what information do we have about like what the needs are, within this space and trying to figure out, again, how we can, best coordinate our efforts to really provide support to you all to advance this work in your states and jurisdictions. So very recently, actually just a few weeks ago, we brought all of these partners together to spend some time. Really, our charge was spending some time doing some systems exercises to really think about what are some potential roles for Title V in the advancing, housing justice space. And so really our guiding question for this is like, what do you see as Title V's role, the responsibilities, the needs, and resources? Again, looking at the intersection of MCH and housing justice. And, Ben said, really recognizing that this is a human right? This access to housing. So what does this look like? So Jess guided us through some fantastic, again, kind of like systems thinking exercises for us to respectively kind of like put together these pieces of the puzzle and, come up with some ideas and suggestions as to like what this could look like based on what we've heard from all of you. So this looks a little scary. This is just a screenshot of one of the things that we did do, which is a system support map, which I know some of you on this call are very familiar with, having done these yourselves, but it really was, again, a place for us to think very concretely about what were some potential roles and then, what were the related responsibilities that you folks in Title V would need to do to carry out that role? What are the resources you would need, to be successful in that role, like, et cetera. So this is just kind of all of the ideas. And then Jess was able to take all of this and turn it into something very beautiful and far more succinct. So what you see here is what we kind of landed on as a potential role and subsequent responsibilities for Title V in the housing space. And again, I think what we recognized in having conversations with a lot of folks is that you didn't know necessarily where to start. This felt very overwhelming and very big. And potentially challenging to try to tackle. And so our thought was, in ideating some potential roles and responsibilities, we could then give you all something to look at and reflect on, because again, this is based on our perspectives and not all of you actually doing this work. But we wanted to give you something because we thought it might be easier to reflect on some concrete suggestions. So what we came up with in terms of like the overarching role for Title V is really about like being the MCH expert and strategist, right? That is what you are bringing, right? Is that particular skill set and lens and focus, being a technical assistance provider. So providing that sort of support and capacity building, and also being a connector and bridge between different organizations, between different resources, different ideas. So it's kind of the overarching role that we came up with. And then to support that, these were the 5 responsibilities that we were able to glean from some of those systems mapping exercises. So the first one is build and strengthen cross-sector housings and MCH partnerships. The next one was identify opportunities and advocate to better integrate MCH in housing programs and policies. The third one was align MCH and housing systems. So thinking about eligibility criteria, referrals, data coordination. Data was like a big thing that kept coming up, that there was an opportunity there. The next one was leverage funding and resources for MCH housing activities. So not necessarily you having to implement your own housing activities, but how could you use some of those Title V funds to support existing housing activities for MCH populations? And then the last one was evaluate MCH and housing needs in current or innovative programs and policies. So again, I think just recognizing what are particular like deep bench that MCH tends to have in terms of like the eval and the data, and a lot of folks spend a lot of time steeped in that, and like that would actually be beneficial to some of these housing programs that just do not have the capacity to do that in great detail. So I have not looked at the chat. I see a lot of things are going on in there, but I know that just dropped in the actual explanations for each of these, like what they look like in detail. And so we actually are going to give you some time. We wanted to have you all look at this and reflect on it to see, like, does this resonate? What is unclear? Because again, our thinking with this was to provide you with a starting point. Like, these are some things that we think could work based on what we understand to be your particular like strengths and skills and resources you bring to the space. But again, feel free to make this your own. So we're going to do this as a Menti exercise. So just in the chat has just dropped the Mentimeter. So I'm going to stop screen sharing for a minute and I'm going to pull up that Mentimeter. And the first question we're asking you to respond to, and again, Jess has dropped this in the chat so you can look at the particular responsibilities and the descriptors for each. So please pull that up. But we want you to just share what word best captures your initial reaction to these potential responsibilities and activities. Again, feel free to get creative. If you're someone who loves to hyphenate, like we'll go for that. We'll still count it as one word, but any sort of initial reactions to this in one word, what would you say? I'm gonna go ahead and screen share that for you all.
I just saw the word accurate and finally, and just that has made my heart so happy already.
Okay, that's amazing. Thanks, Jess. Okay, so braiding, intentional, savvy, growth mindset, partnering. We all have very unique responses, which I appreciate. Sometimes if folks have the same one, you'll see, right, that one tends to become a larger word. But yeah, any other initial one-word reactions? You're also welcome to type in the chat if there's anything else that comes to mind, or if you want to say something in more than one word. Okay, partnering, multiple people have said partnering now. That one's getting a little bigger. Okay, we'll give it just another couple of minutes to see. Comprehensive is also getting big. Oh, and we have braiding and weaving dollars. So we've got two that are in the same vein there for direction. So like providing some sort of direction. Yeah, I think similar to Justice makes me feel really happy because I think we too, it's hard to know what you don't know. And I think that's the space a lot of us are in, are trying to educate ourselves on this and what this looks like and learning from our partners who do this work, on a daily basis. And yeah, I think just recognizing that we wanted to provide you all with something a little bit more tangible and concrete just to help get you started, because again, this can be a very nebulous space for a lot of folks to delve into. So yeah, okay. Well, thank you so much for that. Jess, was there something you wanted to add to any of the words that you see popping up? Okay.
Thank you. Two thoughts. One is that I see the word overwhelmed and just want to validate that, like knowing and having some clarity on what the space and responsibilities look like doesn't necessarily make it less overwhelming. So that's a really fair reaction. And that's where we want to like provide wraparound support and really talk about what we can do together to make this less overwhelming. So just want to say and like validate both that it's nice to see some clarity in what the Title V roles and responsibilities are or could be, and it could still be overwhelming. So totally valid there. And to your question, Elizabeth, these graphics will absolutely be posted on our website soon. We're in the process of building out like a housing and food security page broadly with a bunch more resources, including this infographic. But happy to, encourage folks to use the graphic that I shared and just feed it to AMCHP in the meantime. Please feel free to use as much as would support your work.
So much, Jess. And the other thing too is that, based on your feedback, and then we also shared this back with the group of partners who helped to, ideate to come up with some of these, we'll plan on incorporating some of that feedback as well. So, we'll make any revisions if needed based on that. But again, just really appreciate you all sharing your initial thoughts and reactions to this, because it does seem like we're on the right track, I think, with some of these pieces. So I'm going to move us to just our second question, again, just reflecting on these roles and responsibilities. Which of these responsibilities are you most excited to pursue? So I know we talked a little bit about, again, this feels kind of overwhelming. It seems like it's kind of challenging, but are there any of those responsibilities where you're like, yeah, we could do that. Like we've got some things going for us in that space. So again, just feel free to type into the Mentimeter. You should be able to move to the next question, but which of those responsibilities are you like most excited to explore?
Linda, this has been the interim. Can you pull back up that slide so folks can see it on their screen in addition, and then we can pull the Menti back up?
Yeah, I can. Yeah, because I'm not screen sharing that anymore. Yeah, sorry about that, Ben.
No,
Oh, wait, can you see? My internet is cutting out. Sorry. Are you all able
we
to see that
just
in the PowerPoint?
we just see the Menti right now.
Oh, okay.
Linda,
I'm
you
so
might just go to the Google Slides you have open because it's the second slide there, and then it's in the same window that you have up.
okay. Are you all able to see it now?
Yes,
Okay.
it should be small.
Sorry about that. My internet seems to be cutting out a little bit, so everyone's a little slow and garbled. Yeah. So again, take a look at again the definitions of each of the different responsibilities, and then in the Mentimeter, if folks can go ahead and share what they're most excited to explore. And so far, it seems like at least with one, two, three, four of these pieces, it seems like the partnership piece is something that folks are really interested in diving into. Yeah, quite a few of these are related to the partnership piece, which again, I think is something that Title V folks, you're so used to having to work through and with others to accomplish, your activities that again, this seems like a really natural space for you all to be in. I also want to recognize that we have the piece around leveraging funding. We are going to hear about an example of leveraging the funding piece during one of our workshops as well, which I think will be very interesting for folks to learn about. Yeah, the measuring change piece, right? There was a lot that came up in terms of seeing Title V as having, a pretty strong skill set in eval and FE as well, and how that could support some housing initiatives that really just do not have, the same level of like skill or expertise or staffing capacity to do that. Let's see what else we've got. So a lot of partnerships, got a couple eval pieces, another one for evaluation, housing needs in minoritized communities and current or innovative programs and policies. Yeah, so I think that was the other thing too, just in talking about the data and eval piece, is that folks that are partners at the national and federal levels felt that Title V is able, especially with the data piece, able to provide nuance into disparities that might exist and how different programs might actually be improving health outcomes for those particular populations. Okay, any other thoughts? Anything else that you are excited about? You're also welcome to type into the regular chat if you have some other thoughts. Okay, if not, go back to our presentation. And so one thing that I would ask you to do for the rest of the session, because we just want to give you something to kind of leverage or just use as some grounding for the rest of the workshop today, is think about that one housing responsibility that really resonates with you and kind of use that as, again, like your focus or lens for the subsequent conversations today. So really thinking about which of these seems maybe most feasible, most aligned with your existing strengths, or one that you're most interested in exploring, and keep that one in mind as we move through the rest of the activities today. So we're not going to shift gears a little bit, and we're going to delve into okay, well, what does this actually look like? How do we do this? So I think, again, some of you, have heard us present on this in some other spaces, but I think really just recognizing that there is a lot of evidence that exists out there, right? We have these beautiful reports that the MCH Evidence Center just released a few months ago. So this is the one around housing instability. I pulled this from their evidence accelerator. So they've done a lot of the heavy lifting in trying to see like what is already out there that you all could, consider implementing in your context. But with that being said, we have to recognize that like evidence on its own is not going to help us achieve those improved outcomes for our MCH populations. There is a missing piece of the equation. And so really what the missing piece is what we refer to as like that implementation component. And so this is where the field of implementation science is really beneficial for us to focus on, and what we can glean from this field in terms of how to really look carefully at our process and how we're implementing these particular programs based on the evidence that we have that they're going to be, more effective or more aligned with our particular population that we're implementing them within. So really, when we're looking at, implementation science, we're really looking at the specific, strategies or processes or activities that are going to ensure that the, program or policy that we're implementing, other folks are going to be on board with that. They're going to adopt this. They're going to be able to put it in place. And not only that, but it's going to be sustained in the long run, which we know is a very big challenge for a lot of us. And so that's where the field really helps provide a lot of those specific processes and evidence-based strategies that indicate that if you think very carefully about these different pieces around implementing this program, it's going to make it more likely this program is going to be effective, it's going to lead to equitable outcomes, and it's going to be sustained. So that's a lot of jargony terms. So really, when we're thinking about this, we're really looking at how we do our work. So that's kind of the missing piece, right? The evidence is what we could do to address this, or what it is that we want to consider implementing or exploring. But implementation really helps us to slow down and think about how are we going to implement this, and what that's going to look like. So I want to walk you through just a little example, kind of thinking about our housing example. So funnily enough, when we talk about implementation science, I usually use a housing metaphor, because just like as you're building a house, you can't just, put it all together at the same time. Really, you want to make sure you're starting from a solid foundation. Then you're building the walls, right? You're putting on a roof. You're making sure that you're then adding, other touches like the windows and the doors and decorating on the inside. So it's the same way with implementation science. It really helps us to think about our work as a process and something that takes place over time, not all at once. So really, this worked out it was very apropos, that we're talking about your MCH housing initiatives, because that's the metaphor we use for thinking about implementation. So that might make it easier to keep in mind, but really thinking about, houses are not built overnight, so just thinking about the process, it takes time, it takes intentionality, it takes a lot of planning, a lot of thought, and a lot of consideration to build something that's going to be, durable, essentially. So what we're going to do is now look at this kind of as a one framework. So this is one way that we can think about your housing initiatives and implementing that over time, to kind of think about, well, what do we need to consider at different points in that process? So the implementation stages framework is a really helpful way. We use this in a couple of our projects, including with the Workforce Development Center. That's where this comes from, is with that project, and then also with the National Implementation Research Network. So appreciate being able to use this, because we found this to be a framework that really resonates with folks. But essentially, within the context of implementation, it's this idea, again, that the work happens in phases or stages. It doesn't just naturally happen all at once. And there are very specific implementation strategies that we can look at and address in each of these stages that are going to help set us up for success as we move that particular work or program or policy forward. And so the first stage of implementation is what we refer to as exploration. So this is the one that I usually talk about, is you're kind of getting a lay of the land and really understanding, what are the particular needs that exist within a specific context or community or population? What are their values? What are their strengths? What are their resources? Really working with the people who are going to be most impacted by this work from the very beginning, so that they are part of the conversations and the decision-making processes around what gets implemented and how it gets implemented. So it's then, using this stage to understand what are potential existing programs or policies or initiatives that we could implement? Do we have to create something that doesn't exist, or can we leverage something that already does exist? We just have to make some adaptations or changes to it. So it's also understanding what's already out there, what's already working, especially looking within, communities and looking at that community-rooted evidence and what already works for them and how you could amplify that. So then it's kind of carefully considering these potential things that you might be implementing, considering, again, how well aligned is that with the need of the folks who are going to be most impacted, or the folks who will be implementing this? How well does it fit your resources that you have? And then thinking about like, do we have the capacity? Just because it's a really great program or initiative and it seems like it's a really good fit and it's well aligned, doesn't always mean that you necessarily have the leadership buy-in or the capacity, or the staffing like skills, staff don't necessarily have the skills, to implement this. So those are things you all have to consider. And then lastly, you actually would select, what is that we're going to move forward with. And then from there, we move into installation. And so this is the stage, I will say, just now having been in this space for several years, is the one that we don't really have the luxury to focus on, but it's one of the most critical stages. A lot of times when we get funding, we're kind of jumping immediately from exploration to initial implementation. It's like, okay, this is what we're going to do. This is how we're going to do it. Let's get started. Installation is absolutely critical, and it's where you're slowing down. Now that you know what it is you're planning to do, it's like, how are we actually going to operationalize this? What changes do we have to make to our proposed program or policy or initiative so that it is better aligned with, again, the needs and the preferences and the values and the strengths of, the community in which we're going to be implementing this or the context we're going to be implementing it within. If there are any resources that you need in order for this to be successful, it's spending the time to figure out, well, how are we going to get these resources? What does that look like? A lot of this is also developing critical partnerships to support this work. And building the internal infrastructure within your organization or other, partnering organizations to be able to do this. So making sure staff have the skills and support and, knowledge necessary, like in self-efficacy to feel like they're confident in carrying this out. Leadership is like bought into the value of doing this work. If any internal processes or even processes like between organizations need to be changed or updated so that this is a smoother experience for folks. Again, it's all about what do we need to do to ensure that this is going to be successful and really spending the time to like shore up that infrastructure, both within your organization and then, with other organizations as well. From here, we then move into initial implementation. And this is, when we talk implementation, this is where focused minds immediately, jump to, right? Because this is where it's like, we're actually doing the work. But I would also, have us reframe that and think about exploration installation is also doing the work, right? So it's really just kind of expanding our understanding of like, this is all the work, all of these stages, not just once we get to like traditional like implementation. But this one is all about its initial implementation. So it's all about testing, right? There's never going to be a program that is like 100% going to work right off the bat, right? It's always about going in with this learning and growth mindset of like, this is what we think is going to happen based on X, Y, and Z, based on this information, based on the fact that we have people who are impacted, in the driver's seat in terms of like creating this and talking about how we're going to implement it. And there are still things that probably aren't going to work the way that you anticipated, right? We can't account for everything. So it's really how can we test things out, in a small way, or with, fewer people or within a context where we can kind of work out some of the kinks without having like unintended negative consequences, on the folks who are participating. So how can we kind of figure out what's working, what's not working? How can we collect that information? How can we make real-time decisions about this? And then also continuing to make sure that staff or people who are implementing this work feel that they are supported and have what they need in order to do this effectively. And again, in that you're continuing to communicate with those who need to know about what's going on, like how it's working, what you're learning, any changes that need to be made. And then from here, we go into full implementation. And I will say a lot of programs don't actually end up making it to full implementation because this is when we're looking at things being sustained in the long run. And a lot of the work we do ultimately isn't able to be sustained a lot of times because we're not necessarily able to focus on these other stages. So it is really critical actually focusing on these particular implementation strategies can lead to overall program sustainability. So this is when you're looking to, sustain and scale up a particular program or policy or initiative. Folks are like bought into this. It's kind of like baked into the day-to-day of the way that your organization works. It's not like an add-on thing. It's like, this is just the way that we do our work. Like this is, the program that we've always implemented. But also again, continuing to identify that there's still opportunities to learn from that program or policy and to like make changes and continue to modify it so that it meets folks' needs, because those needs and values and interests can change over time, right? And we want to make sure that everything is still kind of aligned with the folks that are going to be participating, in these programs. So I could go on this. I could talk about this for like 2 hours for sure. So I'm going to cut myself off right there. Just wanted to give you all a solid grounding because we've essentially aligned our workshop today and the one in December with the implementation stages. So just a few of the things to mention. is that engaging the community. And I will say the community, we use that term, very, very broadly, but it's really looking at those folks who are going to be most impacted. So it's very critical before you're even getting started is defining what you mean when you say community, like who is that? Like who's included, who's not included, and having the folks kind of self-identify in that way as well. Like how are they considering this? But making sure that they are included as key decision makers throughout the entire process. And then the last thing to know is that this does not happen overnight, just like building a house does not happen overnight. It takes 3 to 5 years to actually get from exploration to full implementation. So I say that just so you all don't feel like if you don't get this right and it doesn't happen within 6 months that you failed in some way, right? A lot of this process is figuring out what works, what doesn't work, and being able to take that and kind of incorporate that and move forward with it. So it does take time, but again, if you're able to move through these different implementation strategies through these stages, you're more likely to end up with something that will be sustained and it will be more effective than if you weren't necessarily able to follow through. And the other thing just to note is you'll see that we have bidirectional arrows when we talk about this framework. And that's even though these are like discrete stages, because it's easier for our heads to wrap around this concept, they all kind of blend into one another. And so you can move backward through a stage to a previous one. You can move forward. You can have parts of a program or a policy that are in different stages at the same time. So again, kind of laying this out in a linear way is just a way for us to kind of wrap our minds around something that is pretty complex. But again, I do think that this framing is like very helpful for the work we're going to be talking about. So with that, we're going to dive more deeply into exploration and installation. And so what we've done is we're just kind of blowing up those 2 stages of implementation for the workshop today, and we'll focus on initial and full implementation for the one in December. But thinking about the like housing kind of like responsibility that you picked, right? Or the Title V responsibility that you picked. In exploration, you're going to be really thinking about what MCH housing related needs have you already identified or has the community shared? Again, community hasn't asked for us for you to think about how are we defining community? How are they defining themselves? And how are we using that, as our shared definition moving forward with this work? Because it does change the focus in what you're doing. What existing strengths do you have for each of those Title V housing responsibilities? How have you engaged your community, to do this work? And then with the community, considering each responsibility that we've shared with you all, which makes the most sense to focus on based on your resources, your strengths, your capacity, your needs, and your values. And then working with them, then pick which responsibility and related activities you'd like to implement. Right. So this is all about kind of just trying some things out. It's not going to be perfect, but it just gives you like something particularly small that you can kind of like latch onto to just help get the ball rolling with some of this work if you haven't necessarily done this before. And then for installation, you'd kind of be shifting into thinking more about building up your capacity. And so what changes will you need to make to your selected responsibility to make it better fit your Title V program in your context, right? Because these are just examples that we've come up with for you all, but you might need to massage them a little bit so that it really fits your context. And so you feel like it's something that you can get your leadership behind, you can get staff behind, it's aligned with your partners, et cetera. So really thinking about what makes the most sense for your context and how do you have to tweak this for it to be the best fit. Thinking about what resources you'll need to support this responsibility that you want to pursue. Again, how can you engage the community to implement this? So again, thinking about ways to have them be key decision makers in the process. What structures do you have in place? Can you leverage for them to actually guide the development and implementation of it? Another one, what types of support does staff need? So this is a big one, right? Making sure that they have the skills and the resources and tools they need to do this work. And then thinking about like your organizational systems, your structures, your policies that might need to be changed or modified or developed to better support this. And then the data piece is always going to be big, but really thinking about, do you have these data systems in place that are going to help inform the development and implementation of this particular responsibility? And if not, where do you need to get that from? So that was a whirlwind of implementation. I just want to see in the chat if anyone has any additional like questions or comments. I know again that was very, very fast, but just wanted to provide you all with a little bit more grounding and framework for our conversation today and for the next webinar. And we will be going over the stages again in high level before the next one as well. But just wanted to see if anyone has any questions. Okay, give it another minute. Not seeing any. So what we're going to do now, we are going to shift into hearing from some Title V examples. So we have two states who we're going to share a little bit more about their work, and we've asked them to share a little bit more within the context of exploration and installation, so they can kind of share with that like framing in mind what some of the things that they did or considered to get some of their housing related work up and running. So with that, our first example we have is Ohio. So I wanted to just stop and see if we have any of our colleagues on from Ohio.
Hi, yes, this is Sarah. I'm here.
Hi, Sarah. How are you?
I'm good. How are you?
Great. So we have just here, like, you're welcome to just, again, we said this was very informal for everyone, so you're welcome to just talk. And then Jess was going to capture some like high level components that she hears and some considerations so she can dictate directly on the slide. And if you have slides, you're also welcome to share as well.
I do have, so I presented at AMCHP last year and about our adolescent health program as a whole, but I have a few slides on youth homelessness, so I'm happy to share those if
absolutely.
that helps kind of guide my presentations. Let me see if I can get there. Okay, so I apologize. I'm going to be starting kind of in the middle of a larger presentation. Can you see those?
Okay, we can see that on our end. Oh, you're going to put it in slideshow mode. Okay.
Yeah, can you see? Okay. Okay, there. Sorry about that. Let me put it in slideshow mode. So in Ohio, we probably started out a little bit differently, but we're lucky to start out the way we did. We received money in our state budget in state fiscal year 2019-2020 after our state health department director, Dr. Amy Acton, had really advocated for money to be put in our budget to address youth homelessness. Dr. Acton had experienced homelessness as a young person and understood the connection of housing and health, and so was successful in getting funding in our ODH budget during that time frame. So we get approximately $2.5 million per year to address youth homelessness. So this started, again, we got the money in the summer of 2019, of 2019, and really spent time planning what this would look like. How do we distribute these funds? What is needed? And so the first few months really were spent meeting with, again, community stakeholders, housing stakeholders, to talk through kind of what this looks like, understand the landscaping of housing, and how do we fit into that, and how can we support what already exists. And so what resulted first was the first grant program listed here, which is Services for Homeless Youth and Pregnant Homeless Youth. That was kind of a larger, more comprehensive grant, really trying to address a variety of services. It's not just funding for housing, but it's really funding for providing wraparound support for youth. So the funding could be used for housing, but it also could be used for additional deliverables such as health and mental health support, assisting with employment and education services, including helping youth obtain important identification documentation that they don't typically have. So again, I will say that this was really designed to be flexible funding. We use the McKinney-Vento definition of homelessness, which tends to be the most flexible, in that we know that a lot of the federal funding definitions are a little bit more strict. And so in order to kind of provide a gap or help provide funding for, again, folks who aren't being able to be served through other more strict federal funding. This is really gap filling for a lot of our sub-grantees. So again, the first grant is a little bit more comprehensive. What we realized during that is we had some smaller agencies apply for funding that maybe weren't quite ready to meet the full deliverables, but had some really maybe niche populations that they worked with or activities that they were doing. And so that led to our second solicitation or grant program, which is called Targeted Services. And so that was a smaller grant program that we had initially, again, targeted for maybe some small innovative ways to reach youth or serve specific populations. And so that's kind of how we started. When we first got this funding, it was part of our adolescent health coordinator position. So we had really the funding was used to provide those services to, we've provided the funding to grantees, local health departments or other community-based organizations that applied. And then we put a little bit of the money towards salary, but then our adolescent health coordinator, about half of that position was focused on this work as well. What we learned pretty quickly is that we needed to partner with our Coalition on Homelessness and Housing in Ohio, or COHIO. This is a state level organization that provides support, technical assistance, advocacy in this space. And what we really needed support was data collection. Because in order to show the impact of our program, we really needed to be able to show how many youth are we serving. And so we met with them and first contracted with them in April of 2021 to really get a handle on that. We realized that about half of our agencies were already using HMIS, which is a federal homeless management information system. And so we partnered with COHIO so that they could help us strengthen our data capacity. But then they also provided support to both our agency and our grantees as far as technical assistance and program guidance. So I'm a social worker. I had some experience with housing and homelessness, but this is a very complicated system. And so we needed to make sure that we had that support in-house so that we could make sure that our grantees were set up for success in doing some of this work. Some of our, agencies that we have funded, some have been doing housing for a really long time and were experts and applied for the funding and really used it to, like I mentioned, fill gaps where their other federal funding wasn't available. But we did have some agencies who were brand new to this space and really building housing programs and trying to address youth homelessness in their areas. And so we wanted to make sure that we had expertise to help guide them through that process. So COHIO has been a really long partner in this process for us. And then I will also say in Ohio, we don't have one state agency that addresses housing. A lot of our state agencies have different programs for housing or homelessness. So during COVID-19, really a task force was pulled together to learn, to react to or to respond to the COVID-19 pandemic and make sure that populations who are unhoused were being, assisted through the COVID-19 pandemic. And so once we started to get out of COVID, we realized the importance and how useful it was to have this coalition or this group of state agencies who came together to share what we're doing in the housing space. So we have continued that group, and it's now called the Coalition of State Agency Supported Housing, or COSASH. And I've listed the state agency partners that participate on that. And there are others. I just listed the ones that we in the youth space work most closely with, but in the larger COSASH group, there are a lot of other state agencies that participate in that. And again, just understanding the landscape and the vast array of housing programs that exist. And for our program, so this is we're in the third biennium that this program has continued to be funded. So when we first got the funding, we weren't sure if this was just going to be 2 years of funding and we're done, which is, again, another reason that we didn't really have a full-time person dedicated to this work. Because this is something that has been continued to be supported in our state budget, we hired our first full-time youth homelessness consultant last fall. So so excited to have somebody with that expertise in youth homelessness working full-time on this issue, because she's really been able to come in and look at what we have and look at the data we have and meet with partners and think about what else can we be doing in this space and really kind of expand. And for us, it's also that commitment that if this funding does go in the state budget, we have this permanent full-time position that we're going to continue to support through our block grant or other funding that we have, so that we can continue to address youth homelessness, even if we don't have funds to put towards it. So we're excited about, continuing to have her. Again, I presented last spring, so we've had her for about a year in this position. But, that's kind of where we're at. I would say that's the last of my slides, so I'm going to stop sharing. But wanted to see if anybody has questions first before I go on about what we do or how we do it. I didn't go through the deliverables that we have. I will say that for the first 2 bienniums we had basically continuation solicitations. Our grantees got funding, I think in February of 2020 was the first time we got funding, or we distributed the funding, which was right before COVID. So the first couple years of this program was a little bit challenging. We had a lot of grantees who were new to state funding. And of course, we were dealing with a pandemic, which was really challenging with this population. So we continued that funding through the second round. And so we're in our second competitive cycle. So this biennium, we've had a couple of new agencies, which has been exciting, who participate. I will say the work looks really different depending on the community. As I mentioned, the partnerships are really different. Who we fund looks very different in different communities. And again, I could speak a lot on that, but I see a question. Deborah, go ahead.
Hi, thanks for sharing. I wanted to ask did you find that your entree through the schools and through the kids in homelessness, are you meeting the wide range of homeless partners? And do you think to expand some of the work through, that you can address other MCH populations with that? And is that kind of, some of your plan at all?
Outside of youth?
Yeah.
So for our funding is specifically for unaccompanied youth, ages 14 to 24. That's really been our age range and our niche. There are other initiatives that have focused specifically on pregnant women. And I know Ohio has a couple of examples of that, and I'd be happy to share information, or at least a link that has moved to our Department of Children and Youth, which is not in our area. Because we do address, obviously, many of I would say majority of who is served through our program are youth ages 18 to 24, so more that young adult population. And we do have quite a few. We have a few of our grantees who serve primarily or solely pregnant or parenting youth. So it really depends on the agency, but we do not, for our youth homelessness program, because of the funding, and the funding is only going towards youth, we don't plan to do that. But we have a lot of state partners who have funding specifically to families or to individuals outside. We work with our Department of Corrections, our Department of Youth Services. We've had a lot of conversations about the work that they're doing with youth who are exiting that youth system and moving on. And again, our children's services, there's a lot of different partnerships. I think we have found our niche for our particular program, but I think the framework and what we have done in the partnerships could absolutely, fit any population that you're trying to serve. I think for us, it was really one, understanding the housing landscape, finding the correct partners to kind of map out what again, I don't know how other states are set up, but we don't have, again, one state agency that does this. We did last year apply for a graduate student EPI program through AMCHP, and we had an awesome GSEP student who came to really help us look at what data exists in youth homelessness. You mentioned the Department of Education has a McKinney-Vento program. They collect some data, but that's going to be the school age population. So it's really, again, I think we're always trying to get additional information to improve our programs and making sure that we're reaching the youth who need it the most. So I think leveraging as much as we can to get that additional support, because it's still, even though it's been 6 years, it still feels like a new program, and we're constantly trying to refine it because $2.5 million isn't enough to address all of the youth who are experiencing homelessness in our state. And so really trying to figure out how do we leverage what exists.
No, thank you so much for the question, Deb. Sarah, just wanted to let you know we have 2 more questions that have come into the chat. So the first one is from Julia. Can you talk a little bit more about how you support the data systems? What kind of data are collected?
So we, for our grants, and I'm sure anybody who has grants know, we had really a program report that was what was being collected initially. And we would get like monthly or quarterly program reports, but it really wasn't sufficient to tell us how many youth were being served, particularly if we know that 30 students or youth are being served 1 month and then 40 are the next. We have no idea if those are the same youth. We weren't collecting, obviously, individual level data on the youth. So we had learned that the Homeless Management Information System, it's a federally run platform for folks who receive federal funding in housing and homelessness space. And so when we were talking to our partners at Ohio, learned that I think about half of our funded agencies were already using this system. So what we did was added a deliverable to their grants that required them to use HMIS or a comparable database to collect a specific amount of information. And so we used kind of a recommended report that would be easy for all of our agencies who already use HMIS. We had, of course, like an array of things that we wanted to collect. It would have been really challenging to include everything. So we get data on some measures that were already built into that, again, wouldn't require a whole lot of customization for different HMIS platforms. I know enough about HMIS to be dangerous. We do contract that out, but from my understanding, it's really better to use something that's already built in because we have 9 different systems in Ohio that manage like the administrators of HMIS throughout the state. And so again, we collect data on obviously demographic information. We collect some health information and some mental health information that's already built into HMIS. There is information about I think pregnant and parenting youth. I have my report. I can look at that. There's a variety of things that we collect data on. One of the things that we've really looked at and that we've been able to report is that of the youth who exit housing, a majority of them or exit programming while we have the time, during that time period, if it's, fiscal year 23, of the youth who exited during that time frame, I think it's around a majority of them exit to independent housing, and a majority of those do so without a subsidy. So we've been able to go back to our legislature and our leadership and say, hey, look, this is working. These kids are working towards independence. And I think that's what's been really helpful for them to see as well. But again, we would love to have a lot of additional information, but it's really kind of demographics and limited to what HMIS is able to offer.
Thanks for that, Sarah. And we have one more question from Sarah. Is Title V funding also used for the coalition contract and grantee awards? Or are those supported, oops, sorry, I just lost it in the chat. Or are those supported by state funding and Title V funding is only used to support the new consultant position?
Correct. We use the GRF funding supports all of the grantee awards and the contract that we have for Ohio. We only are using Title V funding to support part of the contract or the consultant position.
I just wanted to see if there are any other questions for Sarah. Again, feel free to come off mute or put them in the chat.
And I'm happy to share if anybody is interested in data or what we collect. I can share more about that. I'll put my email in the chat if anybody wants to follow up with questions.
Thanks for that, Sarah.
Mm-hmm.
Okay, So if we don't have any more questions, Sarah, again, thank you so much for sharing about your work. I really appreciate just hearing a little bit more about what you're doing and how you've been able to, again, like operationalize that, and especially recognizing how key the partnership piece is. And again, just the really wonderful substantive questions as well that were asked. So again, we're really hoping that just like hearing examples and seeing how else people are doing this, like maybe you can take some of this and apply it. So recognizing, again, Sarah, with your population, it's a little bit different than a national performance measure, but the very structure of this work could be applied to a different like age range or population focus potentially. So again, thinking about what little snippets of things that folks are sharing that you'd be able to apply to your own work and your own context. So thank you so much. With that, I was going to invite Elizabeth to share a little bit.
Can I ask one more question?
Oh, sure. Go ahead, Jess.
From our other Sarah Davis in the chat. Is any information publicly available on the ODH website or elsewhere?
Yes, so I saw that question and I kind of forgot to mention that part of our contract with Ohio, leaning towards that sustainability, was for them to create a data dashboard using HMIS that is publicly available so anybody can see kind of what data we do have. And then really it was built to be available to anybody who uses HMIS, not just those who are funded by us. It's a little bit tricky because there's not necessarily an incentive for folks who are not funded by us to put their data there. So we're working towards that because we'd love to be able to look at youth homelessness as a whole in Ohio. But I'll share both of those links so that you can look at those.
Thanks for finding that too, Jess. I missed that in the chat. Okay, so with that, we're going to shift gears a little bit and hear from Minnesota and some of the work that you're doing there. So Elizabeth, feel free to take it away. And then Jess was just going to capture a few things based on what you share.
Perfect. Thanks, Linda. And thanks for that great example, Sarah. I actually think this worked out really well because I think that might be a really good example of the responsibility that we talked about around like leveraging funding and resources, and think that's an awesome example of that. Our example, I think, goes more towards the responsibility around building and strengthening cross-sector partnerships. And we kind of went about it in a backwards way in that for the 2020 needs assessment, as part of the community engagement, something that was being shared over and over again was around the area of housing and the need for affordable, quality, and accessible housing across Minnesota. And so that ended up becoming a priority in our 2020 Title V needs assessment and for our 2020 to 2025 state action plan in the cross-cutting section. And so I think we kind of got a little bit ahead of ourselves in that we were like, yes, we are hearing housing is a need. We need to focus on that. Not really thinking about yet like the projects we're actively involved in or who our partners were. And so that sort of came after as we implemented that priority and started thinking about, okay, what are these strategies and activities we can do to address this? And a lot of it at first was really just like building those connections and partnerships and being able to figure out like where that space is. And we're still working on that. But I think it's also helpful toward a focus on housing and homelessness within Minnesota, particularly with the COVID-19 pandemic, and being further heightened by the racial issues that we're seeing within Minnesota, but particularly within the metro area. So just a little bit of like data to think about, like the context of our housing and homelessness populations in Minnesota. We do have a focus of our administration right now to address housing and homelessness because of what we're seeing within our state. We do have quite a few, I think, data sources available to us, including we have our Wilder Research point-in-time study that's done every 3 years on a single night. Interviews are done with folks who are experiencing homelessness across the state, as including partnerships with tribal reservations. And from the most recent one, which is in 2023, they had found that of those who were experiencing homelessness in the state at the time of that study, 4 in 10 were children and youth. And then that number increases for folks specifically on reservations. And then about half of the homeless population are families. And then that's exacerbated even more when you think about the racial inequities in that for Minnesota, American Indian populations are 28 times as likely to be homeless as their white non-Latino peers, and African American populations are 13 times more as likely to be homeless as their white non-Latino population peers. So there's definitely a need, and particularly to address it from a racial equity lens as well, which is what this group within Minnesota is doing. It's called the Minnesota Interagency Council on Homelessness. And I will put a link in the chat for you to be able to view their info. And this is one of those pieces that we were able to connect to prior to my role beginning about 2.5 years ago. Our assistant commissioner was involved as a part of this Interagency Council on Homelessness in developing what they now call the Crossroads to Justice Housing Strategic Plan. After that, once my role began, I stayed connected to this because I had already been involved prior to my starting in this role as a Title V coordinator in Minnesota. And so I'd already kind of known that this work was happening. I had an interest and previous work experience around folks experiencing homelessness and houselessness. And so I was already connected to some of the folks. But around the same time, our Department of Health also implemented the first position of its kind. And I need to remember the full title of it. It's the Senior Advisor on Health, Homelessness, and Housing, who has that specific focus on making sure there are those connections happening and work addressing those intersections between health, homelessness, and housing. Once that role began, and I began in my role, I made sure to continue having those connections. So in terms of when we think about like what types of funding is going towards it, right now, when it comes to housing, our funding is going towards my role and then my participation in that Minnesota Interagency Council on Homelessness. So we're not currently operating like any grants or providing any funding directly to this project, other than my time that I spend going to these meetings and participating as part of the strategic planning process. So we are in phase 3 of the strategic planning process, which was led by multiple state agencies, as well as 10 justice consultants who all had lived experience with homelessness. And through that, they developed a strategic plan to where each of the state agencies involved took on different pieces of the strategies that were created that are activities specific to their organizations that they can work on implementing. And so for us at the Minnesota Department of Health, we have a longer list in comparison to what we can really do within our Title V program, which is within the Department of Health. But a couple of things build off of this responsibility around building and strengthening those partnerships, but around really continuing to make those connections where they can happen, identifying where we can continue to include language and other opportunities within our Title V programming that we conduct. And some of that is really thinking about like how we're involving people with lived experience of homelessness in maybe like the Title V needs assessment and other strategic planning and action planning that's happening within the division where Title V lies. Also, where and how we're sharing resources around housing and homelessness to our grantees. In Minnesota, 2/3 of our funding goes out to our local public health agencies, and some of them are involved in their own regional housing coalitions and other work related to that. So they have asked, do we have any resources around like how housing is related to public health, or how they can approach housing from a public health lens, what types of activities, what types of funding is available to utilize towards those. So that's part of why I'm really excited to have these resources available, to have some sort of language to lean on to help leverage those pieces. And so we're going to continue doing this work and making sure we're staying connected to that senior advisor on health, homelessness, and housing. We're going to be working on developing some of those resources around different housing and homelessness related issues that local public health and other partners can distribute to communities, as well as doing webinars around what that information looks like, sharing examples, and being able to get folks connected to this work that's continuing to happen at the state agency level as well. And then continuing to just be a part of the implementation of the strategic plan that was created, which I think is unique in its way that they really focused on the intersection between housing, racial justice, and health justice, and what that can look like as agency level action steps. So continuing to stay connected in that way. And I can also share the actual plan, which you can get from that link, but this goes directly to the strategic plan itself that was created. And then I can answer any questions that people have.
Thank you so much for that, Elizabeth. This was fantastic. Just really interesting, again, just hearing the very different ways that this work looks in each state and jurisdiction. But again, I think there's just so many insights and like nuance that folks could then take and apply to their own context. So, and I think you and Sarah for both sharing so many resources. I think that'll be really helpful for folks to refer to after the conversation today. But yeah, does anyone have any questions for Elizabeth? Again, you're welcome to come off mute or put them in the chat, but we definitely still have some time. So if there is something you want to ask, or for both of them collectively, please feel free to put that in the chat or just say it out loud. Not you. You did get some love from Sarah in the chat, so I think people are very appreciative of the resources and what you shared. Oh, we do. Thank you, Sarah, for asking a question. Okay, so Elizabeth, do you have any examples of local public health implementing housing or health initiatives in Minnesota using Title V funding?
Great question. And we this last late spring, early summer, did what we called the Title V tour and met one-on-one with each of our local public health community health boards is what they're called. And we asked questions specific to that, and there weren't any specific local public health led projects other than similar to what we're doing at the state level, in that staff are participating in like housing and homelessness coalitions, work groups, things like that, and figuring out like how they can address like housing. I will say every single visit, and we have 51 community health boards, every single visit, housing was mentioned as a need and an issue that their communities were facing. And so they recognize that it's something they want to address, but there wasn't any specific projects or initiatives that were being implemented, other than some like regional housing and homelessness coalitions that staff were participating on, just sort of understanding like where the areas of work could be. But as of right now, I haven't heard any updates around any specific projects that are being implemented, but would be happy to share more if folks do bring those ideas forward.
Any other questions for either of our presenters? I'm taking a long pause here. Okay, I'm not hearing anything. Again, thank you both so much. I just really appreciate you all sharing from your perspectives this work and being able to go a little bit more deeply into like how this came to fruition, what that's looked like, and also some of the things that you're hopeful for, or things that you would like to see in the future as well. So Jess and I chatted, and originally we were going to send you all into like 2 breakout groups to continue unpacking some of this, for your own context. But what we've decided to do is just do this as a whole room. So I'm going to turn it over to Jess, and I have dropped the link in the chat, but we had just a few questions that we were going to ask you all to generate some additional like insights and ideas on, and then we'll kind of wrap up and close out.
Yeah, thank you, Linda. You all asked great questions of the presenters, and we thought we'd ask you a few questions. So if you come down to slides 4 through 6, just a few thoughts to get you thinking about how the framework of Title V responsibilities and actions applies to your work or can apply. Any thoughts that have been spurred from your Title V colleagues' examples. So thinking about your existing strengths, assets, and partnerships. What do you already have that could be leveraged. On slide 4, feel free to drag a sticky over away from that collective like pile of stickies and start typing on it. And then we'll have you move through all 3 slides at your own pace. The next slide, thinking about what opportunities exist to get started in this space. And the last question, what do you need in order to be successful? Whether that's from colleagues, from a funding perspective, a staff time perspective from AMCHP, try to give a little bit of thought to what you might need next as we think about these first 2 stages of implementation. And again, slide 3 has that overarching framework we covered in the beginning. Let's spend about 5 minutes thinking here, and then we'll come back together to share some themes and close out. You've already added thoughts to slide 4 with existing strengths. Feel free to go to the next 2 slides with opportunities and thinking about what you might need. Seeing some great themes here and a lot of strengths and opportunities, especially seeing a lot of buy-in and interest among staff and partners, some existing collaboration opportunities, some existing data resources, and then some really concrete need around, working together in healthcare and housing, Title V specific resources. So we're, excited to hear this and hopefully helpful to see and reflect on what you already have, what opportunities you have, and what you might need. I want to open it up for any reflections or thoughts. We're a pretty small, informal group, so any insights that this kind of knocked loose for you, or next steps that you're thinking about, or general questions for us or each other. That's fine too. I appreciate you all hanging in for a 90-minute workshop. I also want to open it up to our partners on the call. I know we have HUD and MCHB, no pressure at all, but if you had any ideas or thoughts or reflections, resources to share with this group, please feel free to jump in as well.
This is Jason Amarhaji from HUD. I was looking for the raise hand function, but I thought I would just speak up. Can you all hear me okay? Great.
Yeah, it's a
So
little
let me
quiet.
just share. I always appreciate the opportunity to be part of these conversations and to hear about the great work that folks are doing. And I know a lot of the focus is often on, helping folks, get access to housing, and that's critically important. At the part of HUD where I am, we deliver services to people who already have housing, and in many cases might be transitioning from an unhoused situation and ensuring that they have access to continuing services through the service coordinators that we fund and the programs that we run. So I just want to make maybe a plug that oftentimes the majority of who we serve is women with children, and maybe folks who have been waiting for a couple years to get access to housing. So, still young children and still very much in need of care. So we, being at the federal level, don't do that work directly, but we're kind of unique in that we work directly with the communities. We kind of bypass the states, and that can make it a little challenging for partnership for things like Title V. But we're really hoping that we can help make connections and ensure that there's a focus on serving the population, because we believe that the population that's heavily in need and maybe an awareness of just where those sites are or who to partner with could really help enhance service delivery to those folks.
Absolutely. Thank you, Jason. That's super helpful.
And if anyone ever wants to learn more about that, more than happy to talk about it.
Linda, if you want to take us to our next slide, I can just share our next steps on the AMCHP side. We'll be hosting part 2, which will really cover the next 2 steps in the implementation framework, and we'll hear from 2 more states, I believe, that will be sharing their housing work. So feel free to join us again on December 18th. We'll follow a really similar structure and make sure we hold a lot of time for you all to engage with each other and ask the Title V examples that are being shared questions to continue our learning and exploration of this space. Like I said, we'll also be posting that infographic. We have a list of resources as well, including the resources Jason has mentioned, HMIS resources, and some of the other global kind of housing resources that can help get you started in the right direction that we're looking to post on our website soon too. So we'll be sure to let everyone know when that's live. And on the next slide, we have received MCHB funding for the MCH Policy Innovation Program, and we'll be hosting a learning collaborative specific to housing instability or food insufficiency and initiating or making progress on a policy, Title V led, that addresses housing or food insecurity. So we have a really cool wraparound learning collaborative curriculum developed that we're excited to support Title V led teams, including community-based organizations that will have a stipend available for, your housing or food security partners at the state that we're happy to help you relationship build with and pull into the work. So you won't need to have any partners ready when you apply. It would just be a Title V application, and we'll provide that support in thinking about who needs to be part of your team. It'll be a 15-month opportunity, and we'll be recruiting early next year. So way more to come on that, but just wanted to plant a seed now so you can be thinking about if that fits into your 2025 plans. I think that's it for us. Any questions or closing thoughts? Oh yes, our evaluation. Thank you, Linda. Please take a minute to fill out our really brief evaluation before hopping off. And yes, thank you, Sarah. Thank you, everyone, for joining us. We are really excited to be having this conversation, just one of many, and to continue to partner with you all to advance equitable MCH housing solutions.
Everyone, we'll stay on for just an extra minute or two so that you can still access the poll, but any feedback would be helpful because then we can incorporate it into the next workshop, or make any tweaks or adjustments if we need to. But again, thank you so much for your engagement and for just sharing all the wonderful work that you're doing. But we'll stay on for just a couple more minutes so you all can complete the poll.